I'd like to take a moment to chat with you about some interesting data out of Alberta on coronavirus statistics and what that tells us about who is most vulnerable to having serious outcomes. And then I'd like to tell you about a rather bizarre story about how that information is kind of being suppressed by some people, even including the Prime Minister. Very odd. So the data, though, first released the other week by Alberta Health Services, unveils comorbidity statistics. So that is the underlying medical conditions that people had in addition to suffering from COVID-19. Now, Alberta found out that over 75% of the people who had died of coronavirus in Alberta to date were facing 3 or more underlying medical conditions. 3 or more. Now, in the tally of conditions, it included mild ones such as diabetes and hypertension. It also included very serious ones such as cancer, dementia, cirrhosis of the liver, and more. So there you have it. Those are the statistics, and it gets smaller in terms of having 2 conditions, 1 condition, and then just 2.5% of people who died of COVID had 0 underlying medical conditions. 11 people. And within that 11 people, that includes people in their 90s, for instance, who died of COVID-19. We don't exactly know. They don't give you the full breakdown, but it does at least include a couple people in their 90s. So what does this all tell us? Well, I spoke to several infectious disease experts and they said it's good this information is out there. It's important information to contextualize, to nuance the conversation, and it does point out that yes, people who have these conditions are at added risk. We should perhaps do more to protect them. Some people also said, and hey, what it maybe means is people who have none of these conditions, who are at quite low risk of coronavirus, maybe they don't need to live under all of the restrictions and lockdown measures that are going on. Maybe we can actually make policy choices around this data to protect the most vulnerable and to perhaps liberate low-risk people a bit more than we're doing right now. Makes sense. Okay, and there's the conversation. Some people were kind of a little offended by the fact this data was out there, and they took it to mean that, oh, because they may have diabetes or hypertension or whatnot, that means that their lives don't matter or something. Nobody ever said that, but if you want to respond to the news in that way, okay, go ahead and do so. But what's kind of odd is some more official voices took those complaints, they took that ball and they really ran with it. In Calgary, there's an MP, Conservative MP Rachel Harder. She posted my news stories on her Facebook page, and some of her constituents, they had a problem with that.
Mr. Speaker, do you know what will help save Canadians' lives? If the member opposite and the leader of the opposition stop their members from sharing fake and dangerous news like the member from Lethbridge.
CBC then ran a story saying that this MP was spreading misinformation. And then they quoted one doctor, who's not an infectious disease expert, who said, oh, the fact she's sharing this shows maybe she doesn't care about everybody and so forth. Kind of really odd. And then Prime Minister Justin Trudeau in the House of Commons in Wednesday also pointed out, well, here we have a Calgary MP who's downplaying the severity of coronavirus. This is very troubling in all of this, basically wanting to suppress, discourage people from talking about this data that I was one of the first in Canada to write about that tells us, hey, we have more information about coronavirus. And at a time when we're 8 months into all of this and we're talking about how to make evidence-based decisions, to trust the science, to look at the data, I don't understand why there are some people out there who just don't want to do exactly that.